Stillbirth is when a baby dies before it is born in the second half of pregnancy at 5 months or more. More than 21,000 babies are born still every year in the United States. This is equivalent to a school bus full of children every day. The number of stillbirths in the U.S. is more than 10 times the number of babies that die annually due to sudden infant death syndrome, also known as SIDS. Unlike with SIDS, federal officials have failed to launch a national campaign to reduce the risk of stillbirth or adequately raise awareness about it. Other wealthy countries have put national action plans in place to prevent stillbirth through awareness, research, and care. Dr. Peter Filozoff at Marietta Memorial Hospital has been delivering babies for 20 years. He says talking about stillbirth is something he does in his practice.
We do, and if they have risk factors that we know could put them at risk, we want to talk about that. If a patient wants to contain or carry the pregnancy past the due date, well, then that does increase the risk of stillbirth too. So we talk about the risks and benefits of inducing labor prior to a stillbirth.
Problems with the placenta, umbilical cord, problems with the baby, or serious medical conditions in the mother can cause stillbirth. In about 1/3 of stillbirths, doctors do not know why the stillbirth happened.
Many times when the stillbirth happens, there's no identifiable cause, and that makes it difficult for the mom and dad because it's hard to put closure without an answer.
Dr. Filozoff says decreased kicking near the end of pregnancy can be a warning sign.
Decreased fetal movement can occur normally towards the end of the pregnancy as a baby is getting in a position to deliver. So we ask that the mom pay attention to what we call kick counts, which is kind of self-monitoring the baby's activity level. And if she felt that the activity level was decreased beyond what she had known previously, we would ask her to come in to be monitored or to be ultrasounded.
Neither the Centers for Disease Control nor the National Institutes of Health have consistently promoted guidance telling those who are pregnant to be aware of their baby's movement in the womb as a way to possibly reduce their risk of stillbirth. The lack of comprehensive attention and action has contributed to a stillbirth crisis. Stillbirths are not just rare flukes that happen. Research shows as many as 1 in 4 stillbirths may be preventable.